Hey there, my name is Tyler Mason. I'm a Medicare broker with the Modern Insurance Store. Thank you for taking just a few minutes with me. I'm going to be really brief. What I want to do is just outline the major differences between Medicare Advantage and Medicare supplemental plans. A lot of agents are going to have a preference one versus the other. I think they're both great options, but they are different. So what we're going to cover are the two major plan types: what to know about each, the pros and the cons, how to avoid being misled, and how to get the best rate. If we look at the Medicare supplement, we'll call that option one. Some of the highlights for a Medicare supplement is that it's standardized. So it doesn't matter whether you go with one provider or the other. Plan G, for example, is exactly the same between one and the next as far as coverage. The insurance providers have no say in your care, where you can go, any of that. The only difference is premium. Okay. The next major difference, or the next highlight, is you can change it whenever you want. There's no enrollment windows for your Medicare supplement. Once you're enrolled, if you want to make a change, it's just that simple. We start looking for other providers. And it's accepted anywhere. So if your doctor, if your clinic, if your hospital accepts Medicare, they will accept your Medicare supplement. So it keeps it really, really easy. Now, the disclaimer is that there is a monthly premium. If you do decide to make a change to your coverage, you must medically qualify to do so. Now, there's some exceptions to that, and we can chat about those specifically on a case-by-case. It's also a la carte, meaning it's only going to cover your hospital, your doctors, things like that. It's not going to cover your prescription drug coverage. It's not going to cover dental or vision or hearing benefits. Okay, so that's your Medicare supplement. Your Medicare Advantage, we'll call that option 2. There's no or low monthly premium. There's no medical underwriting for it ever. It includes your prescription drug coverage, and it includes other great benefits like silver sneakers for a gym membership, dental, vision, hearing, transportation, meals. Each carrier is going to be a little bit different, so we can chat about each one of those individually. Now, the disclaimer: it does include a network. You can only make changes to your policy at certain times of the year. And like traditional insurance you probably had with, say, an employer if they offered it, it's going to have a max out of pocket that if you do need to go in for services, you're going to have to be prepared for that. And again, we can talk about those individually. Now, some of the benefits that I offer: 1, I'm non-biased. I work for my clients, not any particular insurance provider. So we can compare all of the major providers. We can look at their differences in plans. Doesn't matter to me which one we choose, so long as it meets your budget and your needs. I'm an advisor on the ground. For a lot of folks, especially when they're initially enrolling in Medicare, there's a lot of questions. You get on the internet, you watch the commercials on TV, you get the stuff in the mail, you get bombarded by phone calls. It's a first time for you. So what's accurate? What's not? Then after you're enrolled, are you going to be impacted by changes and things like that? Rather than you trying to sort and sift all of that by yourself, I actually, as a broker, am able to work directly for my clients to advise them and to answer questions and to help with that. I offer annual coverage review. If your doctors change, your prescriptions change, if you move, if you're just looking to see if somebody's going to offer you a better service than what you're currently getting, I can help you review that regularly. And then, of course, there's no cost for my help. The insurance carriers, they pay my fee for bringing new clients to them. Okay, so you're not negatively impacted by working with a broker. Your coverage is the same. Your premium won't be impacted by it. But you're not left on your own to try and navigate things as they inevitably change year in and year out. Feel free to reach out to me. My phone number there, 513-466-0209. You can call or you can text that number. And then, of course, you can email me as well at tyler@moderninsurancestore.com. Thanks for spending a couple of minutes with me. I'm happy to help, happy to answer questions, and I look forward to chatting with you soon.